You're watching ABC 36 on your side. Good Day, Kentucky.
Well, good morning and welcome back. It is Thursday, so it's time to talk kids with Dr. Caitlin this morning, as always, with Lexington pediatrician Dr. Caitlin Iddings. Well, September is Suicide Awareness Month, and so today we're talking about the very serious topic of teen depression and suicide prevention. Dr. Caitlin, good to have you with us this morning. So let's start by talking about teen depression rates. Have we seen an uptick in those numbers as of late, or what are kind of those numbers we're looking at?
Yeah, we have. Since the pandemic, you know, that was a very isolating time for a lot of teens, and then even just returning back to regular life became suddenly this new novel thing of I have to see people in person and I have to go back to normal things. Some people were living their best life at home doing virtual school during the pandemic. They're like, this is great. I don't have to interact with
different people, you know? Loved it.
And then some were like socially isolated and feeling like, oh, the world's coming to an end. And so we definitely saw an increase in both anxiety and depression. 1 in 5 teenagers will struggle with depressive symptoms at some point in their life, right? And so that's definitely something that's been on our radar as pediatricians. A lot of places have implemented new screening tools at Well-Checks just to do that little check-in with teenagers on, you know, and it's usually just 4 straight questions on any lack of interest in doing things you used to do, or just hopelessness, sadness, you know, just those 2 screeners. And then if you're noticing that there's something kind of up, then we kind of give you the more intensive screener to see kind of what's going on. Could there be suicidal ideations going on, that sort of thing. So those are really important things if your pediatrician isn't doing those, to make sure that you're checking in with your kids, that they aren't kind of having those down moods frequently.
Yeah, okay, because if you're taking your child to the doctor, the pediatrician, hopefully, they're doing these things. If not, or you're worried as a parent or guardian that your teen might be feeling some depression in some way, what can you do? Maybe ask some similar questions?
Yeah, absolutely. And so there's this big thought from parents that, well, if I ask about suicide, that's somehow going to plant a seed in the teen's mind that, oh, well, maybe that's something I should consider. And studies have not shown that at all. Asking is not going to suddenly make them be suicidal, right? But it is going to open that communication line, which is really what's so important for this. And if they don't feel comfortable talking to you as a parent, making sure that you're reaching out to a coach or a teacher or a pastor or a mental health professional, someone that they will talk to, right?
Someone they feel comfortable
And not
opening
every
up to.
therapist is for every kid. I always say that. Sometimes it takes a little bit of, you know, a couple sessions to get used to this person, or you might be like, this isn't a good fit, and I always say, well, try someone else, right? But really the most important thing in prevention is finding that person that they feel comfortable, that they can talk to and work through these problems with them.
So prevention is the first step, but let's say we get past that and they are experiencing depression or maybe suicidal thoughts. What are the treatment options available?
Honestly, this has been studied extensively over the past 50 years. And the best chance of coming into remission for depression and suicidal ideation is sort of a bimodal treatment method. So seeing a therapist, doing something called cognitive behavioral therapy, and then in conjunction with that, sometimes medication, right? And so usually those 2 things together give them the best chance of feeling better. CBT alone can give them a good chance of feeling better, and medicine alone can give them a good chance of feeling better. But sometimes if they're that severe, and I'm not saying medicate every kid, and I always tell kids, pills don't teach skills, so we have to learn coping mechanisms. We have to do the therapy too. I really encourage all my kids who are on medication to also be in therapy, because that's how you learn to cope and get better, right?
Yeah, and maybe learn a little bit about why you're feeling this way, and that you're not alone, and that some of this has nothing really to do with your environment. You could be, you know, it could be just chemistry.
Exactly.
Yeah. Okay, so if people want to find out more or maybe have more questions, are there some like resources out there that people can look into?
And so, in one real quick plug, so the KIPS survey that Kentucky does for all middle school and high schools every year, this is a prevention survey where they're basically asking them a barrage of questions from and it's anonymous, so the kids are honest on it usually. So, but that's been delayed this year because of Senate Bill 150. And so you have to give permission for your kid to do that survey. Please do that next year if you have a teenager or high schooler, because that is the best data that we have to be able to gather, you know, how are kids really feeling? Because they're not going to always tell the doctor, they're not always going to tell their mom that I'm using substances, I'm feeling sad, I've have thoughts of suicide, but usually they'll report it on there. Usually we get about 80% involvement. You can opt out of that anytime as a parent, but we really need that data. So give your kids permission to do that next year.
Okay, a good note there to help keep kids safe. Dr. Caitlin, good to see you this morning. We're back in just a moment.